My name's Greg Felt. I'm Director of Public Health in Sheffield. This is a short piece of video on where we are in terms of the epidemic. So just some numbers first. As of yesterday, nationally, somewhere in the order of 1.8 to 1.9 million people had been tested, of which a quarter of a million or 246,000 people had tested positively. And of those that tested positive, 34.7 thousand had sadly died, and that includes all of the settings, not just hospitals. So locally in Sheffield, the number of people who we know have tested positive is 2,477, and it's worth me saying that the number being tested positive day by day has come right down. We're really low levels now, so Sheffield is recording on average of about eight positive tests a day over the last 7 days, there or thereabouts. In terms of the numbers of people who sadly died, as of earlier this month, 12th of May, there were 348 deaths registered in Sheffield, with a mention of COVID-19 on the death certificates, regardless of whether or not they'd had a positive test or not. And again, that number has happily come right down. It's now in single-digit numbers every day. So 2-3 cases, 2-3 people sadly die a day every day, and we expect that to come down further still. So the number are coming down. We know that some communities are significantly more affected than others. So it is clear that the first wave of this pandemic is coming to an end. Obviously, that's fantastic news. And that hasn't happened by magic. It's happened because the people of Sheffield have observed social distancing regulations. They've observed the need to wash your hands regularly, and all of those things collectively have made a big difference. So whilst the first peak has just about passed, there's still a significant risk of infection, and there's still a significant risk of a second and or further waves of this virus, and you've seen what it can do. So we want to avoid that at all costs. None of the fundamentals have changed. None of the fundamentals of how viruses spread have changed at all, really. So the more social contact that we have, the more opportunity there is for the virus to spread. The more that we don't wash our hands regularly, probably the single most important thing that makes a difference, the more opportunity there is for us to become infected. So obviously the opportunity for a second wave is there. We are continuing to observe and work within the government strategy. So you will have seen the comms message that's being put by the government: stay alert, control the virus, and save lives. So we're working within that. What we are doing is that, again, we're working within the government strategy for a conditional easing of the lockdown, and that will come over the next 2 to 3 weeks. And I'll emphasise the word conditional there. It's conditional on us all doing what we're advised to do about washing hands and social distancing, etc. But importantly, we are focusing in Sheffield on protecting the vulnerable, keeping people safe and well as we come out of the lockdown, and very carefully getting the city back to normal. I suspect there will be a new normal because, as I say, none of the fundamentals have changed, and there is always the potential for a second and or further waves of a pandemic, which we all want to avoid. So it is a conditional easing, and it does depend on us continuing to observe government guidance.